el evento para que entren los panelistas virtuales,
Gracias,
perdón,
Fernando.
los invitados virtuales. En 3,
Y
2,
pueden empezar
1.
YouTube también. Buenos días, bom dia, good morning. Mi nombre es Patricia Morsch, asesora regional del programa de envejecimiento saludable de la UPS, y tengo el placer de darles la bienvenida a nuestro seminario virtual dedicado al lanzamiento del reporte La década del envejecimiento saludable en las Américas, situación y desafíos. Este reporte representa una serie de publicaciones desarrolladas de manera interagencial en el marco de la década del envejecimiento saludable en las Américas. El día de hoy celebramos el lanzamiento de la primera serie de 15 artículos publicados en la página web dedicada a esta serie, que contará con actualizaciones periódicas y pueden acceder en esta página web. El link para acceder a la página y los documentos se encuentran en el chat. Todos ellos están disponibles en español y luego estarán publicadas sus versiones en portugués e inglés. En este evento de 1 hora, contaremos con las palabras de las autoridades de las agencias de las Naciones Unidas y del Sistema Interamericano que participaron de la elaboración de la serie, así como de la ministra de Salud de Chile. Muchas gracias a los panelistas y a todos que acompañan hoy nuestro evento. Obrigada, thank you. Antes de invitar al doctor Barbosa, director de la UPS, a hacer la presentación de abertura, aprovecho para darles algunas orientaciones. El evento está siendo transmitido en 4 idiomas: inglés, portugués, español y francés. Les pido que aseguren que estén en la sala del idioma de su preferencia. Para acceder a ella, hagan clic en el botón de interpretación en la barra inferior de su pantalla. Es un icono en forma de globo terráqueo. Esta sesión tiene transmisión en vivo por YouTube en Pajo TV y será grabada y posteriormente compartida en la página de envejecimiento saludable.
Healthy Aging page of PAHO. Also take into consideration that this is an information system. There will not be a question and answer session at the end. I'll end this welcoming, and I'd like to invite Dr. Jadwas Barbosa to make his opening remarks. Dr. Barbosa? Thank you, Patricia, and good morning to all of you. I'd first like to thank the Minister of Health of Chile, Dr. Jimena Aguilera. Chile has had an important leadership position in the topic of healthy aging, and I think not only in the region, but worldwide. I also want to thank the presence of the President of the Inter-American Development Bank, Ilan Goldfang. It's a pleasure and an honor to have him participating with us at this seminar. There is a microphone on. Please turn your microphones off. I believe there is someone with a microphone on. Could you please mute your microphones? Please mute your microphones. I am sorry, but I think it's important for everyone to mute your microphones. Please. Do not mute all microphones because you'll mute the interpreter's microphone as well. Okay, thank you very much. Very well, good morning. Older persons who are with us, esteemed authorities, distinguished panelists, members of the United Nations agencies, of the Inter-American System, government authorities, members of the Inter-American System, and participants in general. I want to welcome you and thank you for your presence at this event to present the publication of the series of documents entitled The Decade of Healthy Aging in the Americas, Status and Challenges. I am honored that today we are presenting you a high-level technical product, which is the result of the joint work of the organizations and agencies that have joined us, as well as other academic and civil society institutions that have also participated. In 2021, with the launching of the Decade for Healthy Aging, the organizations and agencies of the United Nations and the Inter-American System decided to coordinate efforts to advance our objectives in the Americas. Today is the first milestone in this joint work. The series of documents presented today is a significant advance in the consolidation of data and information on aging of the population, health, and well-being of older people in the Americas. Through the analysis of these documents, it will be and address many of the opportunities and challenges that the profound and accelerated aging of the Americas will impose on health, social protection, the economy, and ultimately for the development of our countries. The United Nations Decade for Healthy Aging calls on all of us to work in a cross-cutting manner to improve the quality of life of older people, their families, and communities. We cannot talk about or even imagine an inclusive and sustainable development if we do not put people at the center of our strategies. And this implies putting the older people at the center as well. And I'm not only referring to the older people today, but also those tomorrow and even further. So this makes us continue to work and collaborate to promote the continuous generation of knowledge and the development and exchange of strategies and interventions that will help improve the quality of life of the older people and the populations, favoring the welfare of all citizens throughout the entire life course. On the planet, and particularly in our region, we are living at a time of accelerated transitions of all kinds: climatic, social, demographic, epidemiologic, technological, and many more. People who have aged or are aging at this time have advanced in their life course in a context plagued by great inequalities and have influenced this life course and determined the conditions in which they live their old age. In addition, the COVID-19 pandemic, whose onset coincided with the beginning of the Decade of Healthy Aging, had its main victims in the older populations, and the direct and indirect impact on them was catastrophic throughout the world, but particularly in the Americas. As director, one of my first commitments to PAHO and the region is to work with member states to put an end to this pandemic with the best tools available. Poverty and inequalities determined the way the pandemic developed in our region, and this was especially relevant among the older people, especially those dependent on care. Many articles in this series present information on the impact of COVID-19 on the older people. Understanding what happened and how it was handled can help countries to act in a targeted manner to protect the older people and promote effective recovery interventions. A second commitment we have at PAHO, intrinsically related to the first, has to do with applying the lessons learned from the pandemic and vigorously address our vulnerabilities. Older people saw their rights violated in different contexts during the pandemic. And we must learn from this and seek the tools to prevent a recurrence. Some of the articles in this series focus on this situation and help to raise awareness about the inequalities that older people experienced and recommend courses of action, especially to favor greater protection for this population in future health emergencies. And now I shall change to English.
Considering that the older population is currently the group that uses health services the most, to meet these needs, it's essential to guarantee equitable and timely access to health innovations. Supporting countries to evaluate their health systems so that they respond more effectively to the needs of older people must be a priority. These actions should be considered in the construction of a resilient national health system based on renewed and strengthened primary health care. Primary health care must be prepared to respond to the challenges of the complex epidemiological and demographic framework of the population. This not only implies an increase in resources, but also the introduction of innovative approaches that ensure the integration of care, especially between health and social services. This published series of articles show strategies and tools to promote the monitoring of health systems to provide better services to the older population. They analyze the situation of long-term care and the barriers to access to care that older people face, as well as the situation of different population groups that many times are left behind by health systems, such as older indigenous or LGBTQI+ people. To achieve healthy aging in the face of so many challenges, we must strengthen the capacity to support member states. To provide better strategies and tools to the countries in the Americas, we need to work together with a plurality of actors, not only with the organizations of the United Nations and the Inter-America system, but also with civil society, academia, and the private sector, and use multidimensional and multifaceted approaches that are imperative to effectively address these challenges. It is also essential to seek the voice, guidance, and participation of older people at all levels of this collaboration. Dear colleagues, the Decade of Healthy Aging is an opportunity to catalyze our efforts to promote coordinated work with the goal of achieving improved health and well-being and the greater equity for all people as they age. Aging must be considered as a driver for sustainable development. For this, we must remove the ageist view that is still present in our societies, governments, and health systems. Understand that we must see aging as an opportunity to contribute to economic, social, and environmental development through the active participation of all the adults in society. The achievement of people living longer is a great success. Now, the challenge is for these years to be lived with better health and a high quality of life. And this is a challenge that must be addressed throughout the entire life course. From the WHO and PAHO perspective, healthy aging is defined as an ongoing process of developing and maintaining functional ability that enables well-being in older age. That is, the attributes related to health, which allow a person to be and to do what they value, and that allows other people to not only meet their basic needs, but also to contribute, to continue contributing, learning, growing, making decisions, and building relationships. Once again, I thank all my colleagues from international organizations and agencies that are participating in the launch event today and for joining this initiative. My aspiration is that more and more of us will work each day to achieve the goals of the Decade of Health Aging in the region. Muchas gracias. Thank you. Muito obrigado.
Obrigada, muchas gracias, Dr. Barbosa.
Thank you very much, Dr. Barbosa. And now I'd like to give the floor to Dr. Enrique Vega, head of the Life Course Unit from the Systems and Service Department, Health Systems and Service Department, to chair this panel. Thank you very much, Patricia. And thank you, Director, for your message. And good morning to all of you. Today, we have the honor of introducing our panel with a political and technical level that validates the importance of this topic. It includes representatives from the UN agencies and the Inter-American system. The speakers will present their views and perspectives of the challenge of aging in our region and the importance of advancing in this decade of healthy aging from a multidimensional perspective and multi-sectoral perspective. They are Mr. Ilan Goldfein, President of the Inter-American Development Bank, Mr. Simone Cecchini, Director of the Population and Development Division of CELADE, from ECLAC, Mrs. Mari Carmen Plata, Executive Secretary of Access to Rights and Equity from the OAS, Mrs. Susana Sotoli, Regional Director for Latin America and the Caribbean of the UNFPA, and Mr. Seiso Onoy, Director of Telecommunications Standardization Bureau from ITU. Speakers will have 7 minutes to make their presentation. The social and health impact on development is very clear, and the way in which is approached will be essential for the results obtained. To begin the panel, it is an honor to give the floor to Mr. Ilan Goldfein, President of the IDB.
Buenos días, bom dia, good morning, bonjour. Estimado Dr. Jarbas Barbosa,
Dear Jarbas Barbosa, colleagues from the organizations, authorities from the region, and the public in general, I want to greet you all. And I begin with good news and a challenge. The good news is that Latin America and the Caribbean have the older persons living longer time and with a better quality of life. 20 years ago, a person 65 years old would live 7 years in healthy conditions. Today, that figure has gone up almost to 10 years, which means that we are advancing. The challenge is that there are still many important inequalities in the different countries and within the countries. There are many things still to be done. I would like to highlight 3 things. First, that the improvements are largely due to good social and health protection policies. Our studies here at the IDB show that the countries that have the best pension and health and care plans, the long-term care plans, give the older persons the possibility of living 6 years more in healthy conditions. The last 2 decades, in the last 2 decades, the countries of the region have expanded the coverage of the pensions. From 2000 to 2019, the percentage of persons over the age of 65 with no source of income dropped from 29 to 15%. From women, from 78 to 23, and men from 17 to 9%. Furthermore, the countries in the region improved their formal access to health services, and some even began to create specific policies for care of the older people. The IDB has been supporting this from the technical point of view as well as from the financial point of view. For example, we are offering support in improvements for early detection and treatment of the main chronic diseases in Argentina, Brazil, some countries in the Caribbean, together with PAHO. And the pension reforms in Mexico, Uruguay, and the creation and implementation of care in several countries. The second message, though we have advanced, there are gaps in the coverage and quality for healthy aging. We must work together to close these gaps. Only 69% of older people in the region are receiving a pension, and the average amount is low. On average, the people represent 42% of the salary. Under these low-income circumstances, it's even more important for vulnerable older people to count on health services and quality services. Unfortunately, that is not always the case. The quality of the health services is low, and in many countries, they represent a high level of out-of-pocket expenditure. The region is facing an enormous challenge in prevention of risk factors and early detection and timely management of chronic diseases. In the long-term care, only 5% of older people requiring support for their daily activities like eating or bathing are actually receiving some type of care financed by the public sector. That means that 7.5 million people require a family member or a friend to care for them, or they'll have to pay for the services. The older people face enormous expenditures that would take them to poverty. That's why it's important for us to think all together of these three areas of social protection to design the necessary transformations. And the last and final message is that social protection, promoting aging, healthy aging, is key for gender equity. In the region, women provide 80% of the non-remunerated care, generating a vicious circle. The quality of the care, they work less in the formal market, so they pay less into the Social Security and hence receive less social protection in their aging. But this is not only an economic problem. The burden of care is affecting the health of these caregivers, both physically and mentally. All of these factors dramatically reduce their opportunity for healthy aging. Public policies, inequality, gaps, all of these are priority fields for the IDB. And the demand for care is increasing dramatically. In fact, currently there are 8 million people over the age of 65 in the region who require this care. Due to the aging of the population, this number will increase in 2050 to 23 million. The development of care systems is essential. We are supporting the building and strengthening of care systems, the long-term care systems in several countries, in 8 countries in the region, in fact, Uruguay, Costa Rica, Colombia, Panama, Argentina, Dominican Republic, Peru, and Mexico. To finance them, mixed financing systems are required, including social and co-payment systems with non-contributive systems to ensure the care of the vulnerable population. there's a need to move all efforts with the private sector to provide the appropriate services. Governments play a fundamental role to incentivize the private quality offer. Furthermore, in collaboration with partners like the Development Agency, we have a long-term care policy, which is the Care Network Plus, where 15 countries in the region meet regularly and have done so for the past 3 years to share their experiences. Today, we know that we need to work together. We have to have interagency efforts, generate the appropriate information, and to advocate for consensus to make investment in the quality services. And to end, I want to thank PAHO. I want to thank Director Jarbas Barbosa. I want to thank the organizations present here today. And I invite you to work together to continue to advance in this path. Thank you very much. Thank you very much, President, for your important remarks and your message. Aging as a demographic phenomena, as well as social and economic, must be considered as a course of life focus in many of our countries, where the traditional aging is not the reality. This phenomena appears when many are still facing other challenges. It's an honor then and a pleasure for me to offer the floor to Mrs. Susana Sotoli, Regional Director of UNFPA, to address us.
Good morning, bom dia, buenos días a todos y a todas. En primer lugar,
good morning, everyone. I would like to start by commending PAHO for its leadership in launching this series on healthy aging. And I would particularly like to thank the PAHO director, Jarbas Barbosa da Silva, for inviting us to this event. I would also like to greet everyone here with whom I have the pleasure of sharing in this experience on this panel. Aging is a process that is transforming with an effect on the economy, social systems, and long-term investments in health and well-being. From the standpoint of the populational dynamics, though we have achieved a world population of 8 billion people, and it continues to rise, the demographic dynamic has diversified over the last couple of years, nationally, regionally, and subnationally. For example, 50 countries of Latin America and the Caribbean have fertility rates under the average rate of 1.85 per women. Countries such as Cuba, Uruguay, Chile, Argentina, Colombia, a fifth of their population is over 60 years of age, along with some countries of Central America and the Caribbean, Guatemala, Haiti, Honduras, Nicaragua, in which the process is under the regional average and at the initial phase. Furthermore, in many countries, people have fewer children than they want to have. This divergence between their preference and the results is owing to a number of reasons, mostly how difficult it is for women to reconcile family life, the rise in the cost of living, and cost of education. It's within this context of demographic diversity that we think it's so important to insist on the fact that the rise in the number of older persons should not, in and of itself, be a problem, although it does present a challenge that countries need to prepare for, a challenge that has structural reasons in our countries, in the different types of inequality that exist. And this shows that is rising numbers of older persons only exacerbate or lay bare these difficulties that exist. The world of aging persons is going to be increasingly female, which will bring about changes in social protection and health needs. As said, women also earn less usually, have fewer savings, their jobs are more precarious, and it's more likely that they will not be financially secure. At the same time, they are the ones who uh, most fulfill the caregiving role for older persons. And so a fundamental requirement to address or tackle the challenges posed by aging require greater gender equality. Also, the ability to care for older persons, which is a growing challenge. This calls for intergenerational approach and one of rights for people to enjoy a longer and healthier life. It's important to understanding aging from the life course perspective. Quality of life and well-being as one olds is influenced by people's choices, experiences, opportunities, and limitations that people face at the prior stages. Changes in lives and across generations lead to or have an effect on people's well-being, family structures, income levels, social participation, participation in the political, social, and economic life, generally speaking. So aging is not just a trend we see on the horizon. This is a current challenge. Now, what can we do to ensure that our societies be more inclusive and be better prepared to address these populational dynamics? We could start by making sure that younger generations, as well as older populations, be included in planning processes for development, bearing in mind their needs, concerns, and to design and implement policies, including a gender focus beyond lip service, striving to close gender gaps that are always exacerbated by the aging of the population. Another measure would be to invest in young people, promoting healthy lifestyles. Youth should not be an abstract demographic uh, concept. Actions need to be taken in the present, not only thinking about that in the future, and to broaden universal access to health services and social protection for all workers, men and women, services that are in line with the needs of the rights of older persons, and to offer flexible job opportunities and ongoing training for older persons to facilitate their social interaction. Lastly, but still quite crucial as far as getting out ahead of the challenge of dynamic changes, is to make data available such that we can be prepared for upcoming changes. From the UN Population Fund, we have been addressing this very important agenda from different angles and dimensions. A big part of our effort has to do with recovering or gathering data, demographic data, to close the gaps, civil registry data that would make it possible for us to create a map of living conditions throughout one's life based on populational forecasts. Working in Cuba, the DR, Mexico, Uruguay, we've been talking about the viability of social protection, healthcare, and care systems provided within a changing demographic landscape. We have been working with Cuba, rolling out a policy to address the dynamic, populational dynamic, demographic dynamic, among other things, to create intergenerational venues and spaces for participation and to generate recommendations and solutions to address aging and also the rights of older persons. We have supported the national surveys on aging in partnership with PAHO precisely to promote this discussion, that it be based on demographic evidence. Also, the national system for life care, something we've been collaborating on in Costa Rica, another one of the countries that is already tackling the dilemma of aging. One of the pillars has been active aging with the participation of older persons. To this effect, we have been working with the government to craft an advisory body comprised of older persons to draft national policy on aging. So tackle challenges and the opportunities posed by a changing demographic dynamics calls for considered effort. And so from the UN Fund, we reiterate our commitment to continue working together to promote policies for older persons and to bolster countries' ability to prepare themselves with public policies that are data-based, based on evidence and research. So I thank PAHO for this event, and we will continue working together as we move forward with this very important agenda. Thank you very much. Thank you, Director. Now it's clear that's going to be important for us to change the way we think, act on aging and older persons. It's also clear that we have to view older persons as subjects of right. So I introduce Ms. Plata, Mary Carmen Plata from the OES. Thank you very much. A warm welcome from the General Secretariat on the part of Luis Almagro. A warm welcome to all of the distinguished panelists who are with us here today. I greet Dr. Jarbas Barbosa and his team for inviting us. I would like to say those who spoke before me have already referred to the rise in numbers of older persons, people over 60 years of age, according to PAHO data. By 2015, it's estimated that the number of people over 60 years of age, that is 190 million of older persons who live in Latin America. And so by 2030, it's estimated that within 7 years, 2 out of every 5 people will be over 60 years of age. This data is all very important, and that's why we are here today. And I'm grateful for the initiative that PAHO has taken and for inviting me to speak on the launch of this report, recognizing the fact that the effort put forward by PAHO from the perspective that was explained to us by Dr. Barbosa, that is to lead up the decade of healthy aging in the region. This has been a collaborative effort that brings us here together today, and it has played a key role for us to continue to identify and continue working toward guidelines for collaboration. Now, the good news, as President Goldfein has said, which is the underlying premise, which is that there has been a rise in the life expectancy in the region, and we've come through a pandemic, COVID-19, the results of which has hit hardest the demographic group of older persons, health systems, basic health services, violence, isolation. We have identified different gaps and hazards that affect this age group. A few months back, we celebrated 120 years of PAHO's founding, and at that time, Luis Almagro, Secretary General of the OES, said that even though the work carried out by organizations is always, the two organizations have worked together over the last 2 years, we have seen greater collaboration between the OES and PAHO more than ever, and that stems from the immediate needs, pressing needs of the hemisphere vis-a-vis the pandemic, which calls upon us to share in our burden and responsibility. There's a common outlook too, which is comprehensive access to health and equity being front and center as a guiding principle of this effort. Now, the call for a decade of healthy aging calls for concerted effort that is sustained and serves as a catalyst with older persons at the center of these efforts. And it calls upon us to think about how each and every one of our organizations are a part of and can be a part of this collaboration, this call. So OES offers its full respect for human rights of older persons through an institution created whose cornerstone is the Inter-American Convention on Protecting the Human Rights of Older Persons. With its adoption, the convention was a watershed moment to offer protection for older persons' rights in Latin America and the world. It is the first legally binding instrument on this subject matter, and it seeks to promote, protect, and to ensure the recognition as well as the full enjoyment and exercise of rights on an equal footing, full enjoyment of all human rights and freedoms of all older persons in order to contribute to their full integration, inclusion, and participation in society. Our convention was a result of collaborative spirit in an interinstitutional effort as proposed by the Decade of Healthy Aging. What gave rise to the convention? Well, this shows what we can do by working together across organizations. Today, we face a very important moment. The seventh, that is, Mexico is the 10th country to join in the support for the convention's ratification. 10 countries that are states that are part of this convention. And important progress has been made on the work agenda around this convention that will make it possible for states to continue to create a follow-up mechanism, among others. They will be able to follow up on progress made by the states party to this agreement to ensure compliance with the terms of this convention and issue recommendations for the progressive compliance of it, and also to carry out regional efforts with a view toward strengthening capacities and different opportunities for development and to promote public policies that would favor greater access of older persons to rights, to drive the development of public policy, focusing on functional capacities of older persons is enshrined in our convention, as well as a multilateral focus, which enables us to build a regional culture that addresses ageism based on ancestral concepts that invite us to reassess contributions made by all persons, no matter what stage of life they find themselves in, a common perspective. And that is, from a common perspective, very important for us to gather data. As others have said, we have to seek to understand what older persons' expectations and needs are, what obstacles they face to live fully, and to ensure their needs be met. All of these topics need to be studied, and we need to hear from older persons in this process over the last couple of years. Organizations of older persons have been created to carry out outreach and advocacy. That's why their participation is so important in building public policies locally and regionally. This especially applies to women. As Susana herself rightfully said, women live under unique circumstances and who play a social role that they have throughout their entire lives. We also need to bear in mind that challenges rise when older persons are exposed to multiple forms of discrimination, given that they are women, but in other cases, Afro-descendant, indigenous women, persons with disabilities, refugees, migrants, displaced, stateless, or LGBTI persons. At the OAS, we will continue to comply with the mandates adopted by states to support and protect human rights of older persons, and with the mandate that we have taken on at the Secretariat of Access to Rights, we will continue to work and strive for member states to continue to ratify the Inter-American Convention on Protecting the Human Rights of Older Persons, and to educate them about its content, to also offer support toward driving public policy, working with states and international organizations at also regional levels and specialized agencies to promote exchanges, cooperation, to capacity building and collaboration among member states to generate public policies that are focused on older persons. And finally, and no less important, is to include civil society actors as an active players in building this agenda. Thank you, Dr. Jaros Barbosa, Dr. Vega, for inviting me to take part in today's event. Thank you. Thank you, Mary Carmen. Aging in the Americas should be viewed as a present phenomenon, and one for the immediate future would be a strategic error to not include it in our drafting public policy. I'm honored to give the floor now to Ms. Simone Cecchini, Director of the Population Development Divisions. Mr. Simone Cecchini, thank you. On behalf of the Executive Secretariat of ECLAC, a warm welcome to you from him. I greet the Director of PAHU, Jaros Barbosa, and I greet all of the members of the panel, Mary Carmen Plata, Susana Sotoli, and all the participants. At ECLAC, we celebrate the launching of this series of publications coordinated by the Pan American Health Organization on the challenges posed by the decade of healthy aging in the Americas. ECLAC brings its perspective on demographic changes, socioeconomic changes, as well as the situation of indigenous peoples and how that plays into this healthy aging decade. We hope that this analysis will help us showcase and to drive the implementation of the decade of healthy aging in the countries of the region. We would also like to underscore UN projections about population growth. As said before, they show that in Latin America and the Caribbean, the region is quickly aging. In 2023 in Latin America and the Caribbean, persons over 60 years of age are 92 million of them, 13.8% of the overall population of the region. Now, at the end of this decade of healthy aging, 2030, that population over 60 years of age will have grown by 23 million, 115 million, 16.5% of the overall population will be over 60 years of age by the end of the decade. We also foresee a stark growth of persons over 80 years of age. Currently, there are 12 million. There will be 16 million by 2013, two-thirds of which are women. We also know that the urbanization process means that most older persons live in cities, but in the countryside, there's a premature aging of the population given the emigration of working age people. The decade started in 2021 when we were in full swing of the pandemic. And at ECLAC, we have underscored that in Latin America and the Caribbean, ours was the region in the world where life expectancy from birth dropped the most. 2.9 years of life expectancy were lost during the COVID years. We would also like to say that thanks to the vaccination process and our ability to rein in the pandemic, life expectancy will start to grow again. I would also like to say that during the pandemic, older persons were the age group hardest hit not just because of the death rate, mortality rate, but also the quality of life was affected. Their lack of access to social protection, to health, the relative isolation leading to mental health problems, digital inclusion, all of which were exacerbated during the pandemic. The aging of the population should be viewed as a central issue in designing and financing public policy on health, caregiving, pensions, among others. And the importance of public policy, including aging, is going to increase in the near future, considering that we don't see quick fixes to the structural problems of poverty, inequality, lack of parity, affecting the whole region of Latin America and the Caribbean through life's course. We are far from universal access. Those over 65 years of age, the number of people with a pension is only 54% rather. Well, 75% overall, according to two different types of pension coverage. And it's deficient. Even those who are covered, their basic needs aren't always going to be sufficiently covered. And the proportion of people over 65 years of age will not receive enough. They will still be under the poverty line. We're talking about 40% of those people who will receive a pension will still come in under the poverty line. So their income is not enough for them to meet their basic needs. And many older persons will continue working for that reason beyond their legal retirement age, not as an option, but as a need, as an obligation. So inequality in our region overlaps with, is exacerbated by these factors. So public policy should offer access to a dignified and healthy life for older persons. And that means we have to take a human rights approach in how we view aging, and one of gender. The series of publications launched today lay bare the vulnerabilities and inequalities that are structural and that affect indigenous older persons, especially indigenous women. I would also like to stress that the governments of the region, at the 5th Intergovernmental Conference on Aging and the Rights of Older Persons from last December at ECLAC, reasserted what was said in Santiago and the Madrid Declaration on Aging as well. And this is going to lead to a commitment for the respect of to promote and protect human rights of older persons, their dignity, and the fundamental rights of all older persons. And countries ratified the co-responsibility of a state to promote the necessary wherewithal to ensure healthy aging with dignity, rights, and the highest quality of life possible. There was broad participation by civil society on the panels and debates of that organization. We're quite appreciative of that. So ECLAC is fully committed to the health and well-being of older persons in our region, as is contained in the Decade of Healthy Aging in the Americas. And all the different agencies, sectors that are here today, we all strive to ensure that no one be left behind, especially among older persons. Thank you very much. Thank you. We live in a world of much transition, as our director has said, in which for the first time in history, the social life course moves more quickly than the life course of people, and the right to equity has become one of our most important challenges, as the number of panelists have said. I'm pleased to invite Seiso Onoe from the Telecommunications Standardization Bureau. He is the director. You have the floor.
Thank you. Good morning, good afternoon, and good evening. And dear colleagues, distinguished guests, ladies and gentlemen, I'm Seizo Onoe from ITU, Telecommunications Standardization Bureau. Firstly, I'd like to thank the Pan American Health Organization, PAHO, for organizing this event, and also for the inviting ITU to co-publish the report on the role of digital technologies in aging and health. And this report is very timely. By 2030, 1 in 6 people in the world will be aged 60 years or over. The pace of the population aging is much faster than in the past, and the demand for the care for older people will continue to grow. The ITU is a UN specialized agency responsible for the digital technologies, and also is an international standardization developing organization. In this dual role, ITU is fully committed to contributing to the success of the United Nations Decade on Healthy Aging by raising awareness, developing guidelines, standards, and policies, along with the providing strategic advice, sharing the good practices, and strengthening the capacity of the ITU members to leverage ICTs in delivering the innovative solution for socio-economic benefit, and thereby turning these challenges into an opportunity. And digital technologies can play a fundamental role in enabling the older persons to overcome age-related disabilities. It can also help them become active participants in society and contribute valuable life skills and knowledge to younger generations. Older people are strong driver of socio-economic development and represent alternative business opportunities, attractive business opportunity for the technology and healthcare sectors. And digital transformation is fundamentally reshaping the care of the older persons in all its aspects. For example, the artificial intelligence improves home monitoring for older persons by continuously monitoring irregular activities or patterns related to health issues. For example, in terms of the fall prevention, which accounts for more than 50% of hospitalizations due to lesions in people older than 65. AI-based devices are providing voice-based assistance to remind the older persons of their medication schedule. Smart wearables are also providing a convenient means with which to monitor and detect inconsistencies in biometric data and sound an alarm in case of falling or home intrusion. Virtual reality is also being used to improve the mental health of older persons and tax isolation. As we know, social isolation and loneliness among older people are public health concerns and can be reduced through digital interventions and policies that address ageism and inequality. For example, virtual reality enables older persons to visit their favorite locations and to travel to a place where they used to live simply by putting on the VR headset. The ITU is also working closely with the World Health Organization, WHO, and other organizations to develop standards for digital health. Standards are crucial for unlocking the full potential of digital health and improving the care of aging populations. E-health applications, telemedicine, wearable devices, and other multimedia systems need to be supported by a vibrant, interoperable Internet of Things ecosystem to maximize their benefit. International standards also play a key role in making sure that health data can be easily shared across different platforms and systems. And the use of standards is the most effective way to enable interoperability. In a world that is aging rapidly, I would like to reaffirm ITU's commitment to work together to bring in older persons online and empower them to make use of digital technologies so that they can take their rightful place in the global community. Working together with partners like PAHO, I am confident that this is just the start of the very productive and fruitful relationship. During this United Nations Decade of Healthy Aging, we can ensure that digital technologies help improve the lives of older people, their families, and communities in which they live. Thank you. Thank you for your attention.
Thank you very much, Mr. Onoe. Ahora estamos llegando al final de nuestro
And we're
seminario.
coming to the end of our seminar. And for the closing of this event, as our director said rightly, it's an honor for me to invite the Minister of Chile, Mrs. Jimena Aguilera, who has worked significantly in the field of healthy aging, not only regionally, but globally, to hear what she has to say about the importance of this. Thank you very much and good morning. I'm afraid her sound is really not very good. From the south of the continent, I want to thank you for this invitation from PAHO to be part of this very significant event and for the leadership in preparing the series, which is part of the response our region is developing to tackle this problem in the region. So we congratulate you for this, and and for the involvement of all the agencies is a clear sign of how important this challenge is, which is a challenge for all of society, and which in some way has been mentioned by each one of the speakers from the different viewpoints, explaining what this situation of aging means. It is an achievement, true, but it presents a series of challenges for our society, not only for the area of health, which is what I represent at this time, but for all our society, for work, for the care society, for human rights, as all of the panelists have said. That's why we welcome this publication, which we know will contribute significantly to help our countries improve our policies, to have a regional American perspective of this situation of the barrier to access to health services and long-term care and dementia or human rights is without a doubt a tremendous incentive, especially if we consider what's been said, how accelerated the aging process has been in our region, which brings us to an overposition of situations of the aging populations and the challenges that have not yet been resolved in mother and child care or other problems that several of our countries still face. Chile is one of the I'm sorry, but her sound was cut. We have been promoting initiatives in this field nationally as well as internationally for this reason. And we realize that the challenges mentioned by the United Nations during this decade are ours as well. And we firmly believe in the need to change the way in which we think, feel, and act towards aging, and the need to ensure that all communities promote the necessary capacities of older people and people-centered skills. And we need the access to long-term care for older people who may require it. All of these are elements that we are considering directly in the design and implementation of our health sector reform proposal, which seeks to modernize the health sector and ensure universal access through primary health care following the Pan American Health Organization's guidelines to build a healthier society through intersector participation, working directly with local governments to also improve the Social Security health laws. 4 elements which are being considered in our reform project, which are receiving the support of the Pan American Health Organization, ECLAC, the Inter-American Development Bank, and the World Bank. This is together with all the other challenges that are found in other portfolios, which are also a priority for our government, such as pension reform, which is currently being studied in Congress at this time, and the reform and improvement of the national care system, which is being implemented by the Social Development Ministry, where health is an important actor. In this way, as a government, we, not only through the Health Ministry, but through the Labor Ministry and the Social Development Ministry, are working to deal with this problem or challenge of aging, the demographic realities of aging in Chile makes us recognize the need to develop these aspects, dealing with the social determinants, the risk factors, and of course, the life course perspective. Today, for example, we have an estimate of about 2.5 million Chileans who live with 5 or more chronic diseases, and this is particularly amongst the older people. So to promote positive aging, active aging, and healthy aging, we must include the prevention and promotion aspects, focusing on the early and middle stages of the life course. And we have to say that in this context, the Health Ministry designed the National Comprehensive Health Plan for older people with a Plan of Action 2020-2030, together with the Decade, where as the objectives of our work for the next 10 years was to have better quality of life and autonomy for the older people, keeping the population as long as possible, as functional as possible. Of course, the pandemic has had a tremendous impact on these goals. We have taken many steps back in the conditions of the older people. We have reduced the life expectancy. We've increased the burden of mental health. There's been a deterioration of people who had cognitive damages and the tremendous mortality amongst the older people. That's why in the goals of the decade, we must recognize that these are even more of a challenge after this pandemic, which has had Americas as the most affected area of the planet. As for the information, Chile and all countries need definite and reliable information to advance in the strategies to consolidate the goals of the decade of healthy aging and to have policies and actions dealing with healthy aging amongst the populations. That's why we'd like to share with you some of the advances of the National Plan of Health for the Older People in the decade of healthy aging of the United Nations. As a context, Chile has a population which is close to 20 million inhabitants, 18.1% of which are over the age of 65 now. Of these, 25,780 people live in some types of long-term care establishments. We have a total of 1,216 long-term care institutions in our country, which are tremendous support and must continue to develop to respond to the needs. I was saying that these institutions are a tremendous support and must continue to develop to respond to the needs of the quality life required for this population. However, despite the progress, there is the need to improve the quality and implementation of these long-term care establishments. There's an important gap in the quality of these facilities and the type of services that are delivered and the coordination of the long-term stay. During 2020, despite the pandemic, the Health Ministry developed a project to cooperate with the National Service for the Older People and with the Giropolis Study Center of Valparaiso to connect the older people with the health centers and the social protection centers. And in this context, in 2020, a pilot plan was implemented for the integrated care program for older people from the World Health Organization, which included 1,600 people, 60 and over, in 4 communes in the region of the country, evaluating the risk of loss of functionality. And the results will help us improve our responses to the needs of this population. We want to thank PAHO for their support, as well as the World Health Organization's support. I'd also like to mention that our country, we've been working to redesign, amend, and implement the preventive medicine tests for older people to guide us in the health needs by screening the population and helping analyze the relevance of care required for prevention, redesigning the care to measure the possible loss of functionality, which is the model that we're trying to strengthen through the primary universal health care in our reform programs, and strengthen the comprehensive people-centered care for promotion, prevention, and management of chronicity within the context of multimorbidities. We believe that this is in line with the objectives of the decade. As a country, we have many challenges that we have to respond to, considering the needs and characteristics of our population, including the development of and response of intersectoral responses, making the care teams aware of these needs, and the geriatric comprehensive care model, including the planning of intergenerational meetings to consider the ageism in our communities, the specific legislations to give preferential treatment and palliative care. And finally, I want to congratulate the organization for this meeting, and I reiterate our commitment with the decade, not only as a Ministry of Health, but as a government dealing with the different challenges of this for our region, and continue to face this challenge with the continent and with the agencies present in this meeting. Thank you very much. Thank you, Dr. Jimena, for that important message and for sharing this day with us today. I want to thank the panelists, and I want to thank all of you who have been with us here today. And I invite you to visit our webpage dedicated to the series to read the available reports and participate in the development of this report with the interactive form that is also on the webpage. You'll find the link on the chat. Let us continue to work together to promote healthy aging in the Americas. I adjourn this meeting in this way, thanking you.
Bye-bye.
Thank you. Bye-bye.
Thank you. Bye-bye.